Have you ever started a treatment for one health issue, only to discover another condition lurking beneath the surface? It can feel a bit like peeling an onion, where solving one problem reveals the next layer. This is sometimes the case with sleep apnea, especially when it comes to a specific condition that can emerge during therapy. Treatment-emergent central sleep apnea is a type of sleep-disordered breathing that appears or becomes obvious after a person begins treatment for obstructive sleep apnea, often with continuous positive airway pressure or CPAP therapy. Essentially, when the physical blockage of obstructive sleep apnea is removed, the underlying central component, where the brain temporarily fails to signal breathing, becomes apparent. Now, you might be wondering, why would treating one type of sleep apnea bring out another? It is a fascinating aspect of how our bodies regulate breathing during sleep. Normally, your brain sends consistent signals to your breathing muscles, ensuring you inhale and exhale regularly. In obstructive sleep apnea, the airway physically collapses, stopping airflow despite the brain trying to breathe. CPAP works by delivering a continuous stream of air that acts like an air splint, holding the airway open. When that physical obstruction is cleared, the CPAP can sometimes highlight an instability in the brain's breathing control center that was previously masked by the more dominant obstructive events. Without the physical barrier, the brain's occasional pauses in sending breath signals are then able to manifest, leading to central sleep apnea events. So, what does this mean for you if you are using CPAP and think this might be happening? The most important step is to communicate any new or persistent sleep issues with your sleep specialist or doctor. They have access to data from your CPAP machine and can review your original sleep study as well as follow-up studies. They may observe that while your obstructive events have significantly decreased or disappeared with CPAP, you are now experiencing an increase in central apneas. This is crucial information for adjusting your treatment plan. A key aspect of managing this condition often involves adjusting your CPAP settings or exploring specialized therapies. For instance, adaptive servoventilation, often referred to as a SV, is a type of positive airway pressure device specifically designed to treat central sleep apnea and complex forms of sleep apnea. A SV machines monitor your breathing pattern and provide support breaths when your own breathing pauses, helping to stabilize your respiratory rhythm. It is a more advanced therapy that requires careful titration by a sleep expert to ensure it is effective and comfortable for you. Understanding treatment-emergent central sleep apnea is not about finding fault with your current therapy, but rather about refining it to achieve the best possible sleep health. By recognizing that some complexities can arise and working closely with your healthcare team, you can transition to a more tailored treatment approach. This leads to not only fewer breathing disturbances during the night, but also improved sleep quality, more energy during the day, and a significant enhancement in your overall well-being. Your commitment to treatment helps your doctor optimize your path to restorative sleep.